Today is April 3rd, 2023. The time is 10:30 a.m. and I want to talk about SEPI. SEPI is a Norwegian association. The primary governing body is the board, which has 12 voting members, 4 investors, and 8 independent members representing competencies including industry, global health, science, resource mobilization, finance, and 5 observers. Investors and partners. SEPI was founded in Davos by the governments of Norway and India, the Bill and Melinda Gates Foundation, Wellcome, and the World Economic Forum. SEPI partners with AstraZeneca to manufacture 300 million globally accessible doses of COVID-19 vaccine. On This is June 4th, 2020. June 4th, 2020, Oslo, Norway. SEPI, the Coalition for Epidemic Preparedness Innovations, has today announced a partnership with AstraZeneca, which will support the manufacture of 300 million doses of the AZD1222 vaccine candidate to be ring-fenced for the COVID-19 Vaccine Global Access Facility if the vaccine is proven to be safe and effective. SEPI will invest a total of up to $383 million in this partnership. This funding will support the technical transfer of vaccine production technology to manufacturing sites predominantly in Europe, thereby creating additional manufacturing capacity for this vaccine. It will also purchase manufacturing materials and reserve manufacturing slots, securing a total 300 million doses of vaccine for the COVID-19 Vaccine Global Access Facility. Subcommittee of the WHO Global Advisory Committee on Vaccine Safety on AstraZeneca COVID-19 vaccine. April 7th, 2021. The COVID-19 Subcommittee of the WHO Global Advisory Committee on Vaccine Safety has reviewed reports of rare cases of blood clots with low platelets following vaccination with the AstraZeneca COVID-19 vaccine, including COVID Shield, since their onset a few weeks ago. At its most recent meeting on April 7, 2021, the subcommittee reviewed latest information from the European Medicine Agency, along with information from the United Kingdom's Medicines and Other Health Products Regulatory Agency, MHRA, and other member states, and noted the following. Based on current information, a causal relationship between the vaccine and the occurrence of blood clots with low platelets is considered plausible, but is not confirmed. Specialized studies are needed to fully understand the potential relationship between vaccination and possible risk factors. The GACVS subcommittee will continue to gather and review further data, as it has done since the beginning of the COVID vaccine program. It is important to note that whilst concerning, the events under assessment are very rare, with low numbers reported among the almost 200 million individuals who have received the AstraZeneca COVID-19 vaccine around the world. Rare adverse events following immunization should be assessed against the risk of deaths from COVID-19 disease and the potential of the vaccine to prevent infections and reduce deaths due to disease. In this context, it should be noted that as of today, at least 2 million people have died of COVID-19 disease worldwide. Side effects within 2 or 3 days following vaccination, the majority of which are mild or local in nature, are expected and common. However, individuals who experience any severe symptoms such as shortness of breath, chest pain, leg swelling, persistent abdominal pain, neurological symptoms such as severe and persistent headaches or blurred vision, tiny blood spots under the skin beyond the site of the injection, from around 4 to 20 days following vaccination should seek urgent medical attention. Clinicians should be aware of relevant case definitions and clinical guidance for patients presenting thrombosis and thrombocytopenia following COVID-19 vaccination. To this end, the GACVS subcommittee also suggested that a committee of clinical experts, including hematologists and other specialists, is convened for advice on clinical diagnoses and case management. Active surveillance, including sentinel site, hospital case-based investigations should be considered to further characterize these rare events. WHO has developed template protocols that countries could adapt for such studies. The GACVS will meet next week. We'll meet again next week to review additional data and will be issuing further recommendations as relevant. WHO is carefully monitoring the rollout of all COVID-19 vaccines and will continue to work closely with countries to manage potential risk and to use science and data to drive response and recommendations. In extensive vaccination campaigns, it is normal for countries to identify potential adverse events following immunization. This does not necessarily mean that the events are linked to vaccination itself, but they must be investigated to ensure that any safety concerns are addressed quickly. Vaccines, like all medicines, can have side effects. The administration of vaccines is based on a risk versus benefits analysis. The committee's advice is that vaccines based on adenoviral vector should not be used in the Norwegian vaccination program. Their report was presented at a press conference on May 10th with Director Camilla Stoltenberg of the NIPH, Minister of Healthcare Services, and Bent Hoy, Norwegian Expert Committee. Countries should not use AstraZeneca or the Johnson & Johnson vaccines. A Norwegian expert committee has recommended the government do not include adenoviral vector-based vaccines in the national vaccine program. Monday, May 10th, 2021. Journalist Ida Irene Bergstrom. Our advice is that vaccines based on adenoviral vectors should not be used in the vaccination program, Lars Forland, who has chaired the expert committee, said at a press conference this morning. Norway paused the AstraZeneca vaccine on March 11th, following reports of rare but serious side effects from the vaccine. According to the committee report, 8 cases of the rare syndrome called VITT have been observed in Norway. 4 of these people died. This gives a prevalence of more than 1 in 20,000, which is higher than what has been found in most other countries. Norwegian doctors are among the first in the world to say that the vaccine was the cause of the rare but very serious blood clotting side effects. The AstraZeneca pause was most recently extended in mid-April, with the announcement that a committee would take a closer look at the adenoviral vaccines and their use in Norway. The committee recommends that the adenoviral vector vaccine may be given to people who, of their own accord, wish to take one, but only under certain circumstances. We have discussed examples, such as an immigrant in Norway whose family is ill in a home country with rampant spread of the virus. If given good information and the person still wishes to travel, then he or she may be given this vaccine outside of the general national vaccine program. A minority of 4 people in the committee believe that the adenoviral vector vaccine should be given to anybody who voluntarily would like to take them. The government will now take some time to review the report before they reach a final decision. The Norwegian Institute of Public Health recommended that Norway should take the AstraZeneca vaccine out of the national program in April, but the government instead chose to establish the expert committee. Today, the NIPH extended the recommendation to the Johnson & Johnson vaccine. It is clear that the rare but serious side effects that we have seen with the AstraZeneca also appear with the use of Janssen's, Camilla Stellenberg, director of the NIPH, said at the press conference. There is great uncertainty as to the prevalence and whether it occurs more often in some groups, such as according to age and gender. According to Stellenberg's presentation, calculations from the U.S. show a prevalence of these side effects from Janssen in the United States, which is comparable to the prevalence of the side effects from the AstraZeneca vaccine in Europe, though lower than which is seen in Norway and Denmark taken together. Stoltenberg stressed that the recommendation is based on the current status in Norway. We have control of the epidemic in Norway. Reopening is underway, and we have come a long way in our vaccinations of those above the age of 65. Norway has enough messenger RNA vaccines to be able to offer our Norwegians above the age 18 their first dose of a shot within the third week of July. Based on this, the NIPH calculated that women in Norway aged 18 to 50, it would be more risky to get vaccinated with the Janssen vaccine compared to waiting for the messenger RNA shot. Nobody has been able to assure us that it is easy to detect this side effect early enough to treat or prevent it, or secure that mortality would be lower than the high mortality that we have seen so far, though it varies in the different data sets. Rare side effects from the AstraZeneca Johnson vaccines may have been seen in 15-year-old animals. People vaccinated with AstraZeneca reported mild bleeding. And I'll leave it there.